Soldiers and city workers disinfect the streets after Bogota imposes a new coronavirus lockdown. It's the first of a series of rolling measures restricting almost a third of the city's 8 million residents for 2 weeks at a time.
I think that it is very important that people are aware and keep washing their hands. The front of their house, clean their shoes before entering their home. We need to stop the virus together.
Bogota has entered what experts believe will be the worst phase of the pandemic, and the outbreak is hitting the poorest neighborhoods the hardest, where few people can afford to stay home. Like street vendor Álvaro Blandón, who had just started recovering financially after 4 months of restrictions were eased.
The landlord wants to kick us out. I live with my mother-in-law, 2 young brother-in-laws and my pregnant wife. I don't have anything to pay her with except what I managed to make on the streets.
Across these neighborhoods, small businesses, including hair salons that had reopened a few weeks ago, have closed their shutters once again. The mayor says the new restrictions have been planned to minimize their economic impact and pledged government aid to 700,000 people living in the newly quarantined areas. The mayor hopes to avoid stretching hospitals to their limit, but intensive care units are already more than 90% full. Doctors' associations have repeatedly sounded the alarm, saying that the health system could collapse any day at this point, and have called on authorities to reimpose a strict lockdown in the entire city for at least 2 weeks.
We know that various hospitals in the south of the city are already facing the dilemma of who to save, who gets a ventilator and who doesn't. A partial lockdown will not be enough to stop the speed of the spread.
Returning to a total lockdown is a tough choice in a city with so many people in need, but it might become unavoidable if infections continue to rise. Alessandro Rampietti, Jazeera, Bogota.